Hello and welcome back to my channel. So I realize that most of my daylight is spent at work, and this matters because I can't really film a YouTube video at night because I don't have fancy lighting, so I have to use like the daytime light for my bedroom. So I thought, why not start a car series during my lunch breaks and in the morning, and make videos then when I have daylight. So let's see how this goes. So today I wanted to talk about the pros and cons of being a medical scribe. I made a video in the past, not too long ago, about my day in the life as a medical scribe, and I kind of went into detail as to what we do from day to day, but I didn't go too much in depth in what we learn and where I weigh it in my other patient care experiences. Just as a reminder, I was a CNA previously and a volunteer physical therapy aide, and now a scribe, so I have 3 different experiences in patient care. So I'm not saying I'm like Miss worldwide, know everything about patient care, but I do have some credibility in those types of patient care, so I'll be able to rank it from my personal experiences. But okay, I must go. I'm not late to work, but I'm running a little bit behind. Luckily, my work today is only 5 minutes from me, so it's a super short drive, but I will get back to you on the pros and cons of being a medical scribe right when I get on my lunch break. I always forget to say this too, but if you are enjoying my videos or you're a pre-PA and you think you can benefit from them, please subscribe. It really means a lot to me, and it shows that people are actually watching these, and that I should make more. Thank you. Woo! All right, we are back. Today's lunchtime car chat is brought to you by homemade pizza, ingredients from Trader Joe's, my favorite. But anyways, let's talk about the real things. The reason why you're here is the pros and cons of being a medical scribe. All right, so let's start on the cons so that we can end on a good note. Because like I've said before, I really highly recommend scribing. So we'll start with the bad. So the first is one of the more obvious ones. Not all schools accept it. You're not actually touching a patient like an EMT or like CNA would. So some schools don't really count scribing as patient care experience. And since you don't touch the patients, I personally feel like my other experiences where I was touching the patients as a CNA and a PT aide, I got way more practice in bedside manner and being able to communicate and actually physically touch patients. As a scribe, you're basically silent the whole time, so you don't have much say. I mean, I chime in here and there, but it's not anything like I did as a CNA. I don't have as much communication. So I think it is definitely harder to practice your bedside manner. You can watch it and observe it, but you're not the one actually talking, and it's much different when you're actually the one talking. Another thing about scribing, same thing with medical assistant and other jobs. If you are in a specialty, sometimes you don't get to broaden your horizons on medicine. So you have so if you're working at an ENT clinic, then you only see patients about ENT, so you'll get used to their medications and those kind of symptoms, but you don't get to see other types of people. So I guess that could be a little bit limiting. Another thing, I wouldn't call it a con, but it's just something to be aware of. You need to be really good at multitasking and being able to listen to multiple people at the same time and get all that information and type it down. It's not a con of the profession, but it's just something that you have to be really good at and be aware if you are able to type, and listen to people and type. So that's just something to think about before you go into scribing. But yeah, I couldn't think of really any other negatives about scribing. My recommendation for people who are doing, who are looking for patient care experience, if you're first starting out, I probably would stay away from scribing. Obviously you can do it because a lot of schools do accept it now, but I personally would prefer to start out with an experience like patient or physical therapy aide or CNA or EMT, ones who are actually touching and talking to patients, because you need to have that kind of comfort to be a PA. And I think if I had just done medical scribing, that I would not have the comfort with patients that I do today. Being a CNA really allowed me to go through awkward times with patients. I had to take care of them when they were having embarrassing bowel movements, stuff like that, and I was able to communicate through those times and make them feel comfortable. And that is not something I've learned through scribing. Like I said, I don't talk to the patients much. I can give them a little nod or chime in when it's appropriate, but most of the time I'm not saying a word. So that's just my main concern with starting patient care experience as scribing. So like I said, recommend trying something else first and then maybe moving to scribing. But that's just a personal opinion. Now for the pros of scribing, and like I said, there are so many. And first and foremost, obviously you get such great connections with providers. You're working one-on-one with a provider, an NP, a PA, MD, DO, whatever, and you get to like pick their brain. You get to watch them interact with the patients. You get to ask them why they ask those questions, or why this medication, or you get to have that, you develop that relationship with them to where you can ask those questions. And I think that is so helpful for PA school. Another thing that scribing has taught me that my other patient care experiences have not taught me are like basic diseases, medications for them, on like how to control the basic diseases such as like diabetes or chronic kidney disease, the major ones that a lot of people have that you will see at a family practice. As a CNA and a PT aide, we really didn't ask about meds that much. As a CNA, I did a little bit more, but the LVNs and the RNs really took care of that. And there wasn't too much opportunity to ask about that because I worked in a really busy nursing home, so I didn't have that kind of opportunity. So that's something that's really cool about scribing. Another thing, like I said, is you get to see the providers interview the patients, ask them the questions that lead up to their diagnosis. And I think that is so important for PA school, or just really helps you. Obviously, it's not necessary. But it is nice to have that previous exposure aside from just shadowing, because this is like shadowing, you can pay attention, but you can also get lost sometimes in the talk. But scribing, you have to write it down, you have to know what they're saying, so you have to really pay attention. Another thing that's really great about being able to watch the interview process is that you get to see what you want to do and what you don't want to do when you're a provider, because I know some of my providers are a little bit aggressive in certain aspects that I probably wouldn't be aggressive in, and some of them are really lax in aspects that I would want to probably be more adamant about making that a point for my patient to get that done, or to get their flu shot, or whatever it may be. One very obvious pro is that you learn how to chart. Charting is obviously, as a PA, no matter what specialty you go into, you will have to chart. So it's just kind of an edge when you come into PA school that you already know how to chart, you already know how to set things up. I think that's super helpful, or will be super helpful in PA school. A potential perk of scribing that I never considered before is possible job opportunities after you graduate PA school. And it's obviously not guaranteed, and I'm not counting on that or think that's going to happen for me, but I know where I work, a lot of PA students actually rotate here, so MBKU does rotate here. And then I've talked to the providers, and we've kind of joked about possible job opportunities, but they're like, you never know, like it could happen. So I'm not saying like be a scribe because you can be a PA there later on, but it's just, you can network, you can meet more doctors who know other people at other places that you may want to work. So when you're working as a scribe, if you decide to do scribing, keep that in mind and make sure, obviously, always leave really good impressions with people, because you just never know where you could end up. But yeah, overall, I've said in my last video that I think scribing is such a valuable experience, not just for pre-PA students, but also pre-med, any pre-health. I was told by a doctor that I work with that when she was in med school, she felt like, she compared it to a coat hanger, a coat rack. So she said, when she went to med school, she had absolutely no background of anything, so she needed to build her coat rack before she could hang things up on it. And she said, as a scribe, she's like, you're building your coat rack. You know how to set up your HPI, you know what to ask for. And so when you go into PA school, you're just going to learn the information that you need to get from them and put that together with, learn the medical diagnoses and all of that stuff. But she's like, you're building your coat rack right now. And I was like, wow, that's so cool. But like I said before, overall, I highly recommend scribing. Aside from like the little caution that I said, maybe do a different kind of patient care before you transition into scribing. But overall, I've learned so much as a scribe. I've only worked for 4 months as a scribe, and I've learned so much more than I thought I would have learned. Not that I had low expectations for this job, but there's just so much more involved than I expected. So I highly recommend it for any pre-health student, not just pre-PAs. It's just a really great experience, and you get like so much exposure to medicine for really not having to do any like licensure, having any certification. You get so much exposure to medicine, and like pretty quickly too. Like the training process is only like, for me it was like a month and a half, which does seems like a lot, but realistically my CNA program was 2 months and I had to pay quite a bit for that. So free on the job training was really cool. So if you find a scribe job that has free on the job training, I would really highly recommend taking it. Alright, so I obviously can ramble on about scribing for a really long time because I really like it. But if you have any more specific questions, maybe about the cons, or go more into detail about those, or anything about my job or scribing and family medicine, you know where to reach me. I'm my Instagram at whitecoatchasing, and then you can always leave a comment or message me on here. Thank you again for watching, and please subscribe if you enjoy these videos, and I hope you have a really good day. Bye. Also, complete side note, but this pizza is so good. I am so proud of myself.